All right, we are live. And it looks like we have some folks joining us here in the participant room. Hello, everybody. We're going to take just a few seconds and make sure everybody gets here through the virtual door to join us. And while we're waiting, we're going to pull up our presentation for the evening. And probably by the time we get that pulled up, we'll be ready to get going. So hang tight with us for just a few seconds. All right. Looking, it looks like a few people are still joining us a little bit. All right, it looks like it's slowing down just a touch. So I think we will probably go ahead and get started. Good evening, everybody. My name is Michelle Bird. I'm the Public Affairs Director here at Larimer County, and I want to thank you all for joining us this evening. It is a Monday evening, so you could be watching, Monday Night Football or spending time with your family. So we appreciate that you took the time to join us. Jen, can you go to the next slide, please? Yeah, so we're here tonight, just as you guys know, because you're here. We're going to just talk more about the construction that's going to happen at the northwest corner of Taft Hill Road in Trilby, where our new behavioral health facility will be located. Really tonight, the focus of the conversation is about that actual construction project, not necessarily the services that will be offered there, but kind of the time frame for the construction, what the impacts to the surrounding areas will be during construction. We'll talk a little bit about the facility and what it's going to look like. But there will be meetings in the future to kind of talk about services and other things that'll be provided at the facility once it opens. But tonight we're really kind of focused on construction, what the facility is going to look like, impacts. And then at the end, we'll talk a little bit about the future, but we're going to stay on topic of construction tonight. Next slide. Awesome. So the agenda for this evening, I'm giving you the welcome right now so we can check that one off the list. We're going to do introductions really briefly right when I get done reviewing the agenda. Then we're going to turn it over to our presenters for the evening. They're going to talk a little bit about the project, talk about the project background, talk through the construction timeline. We're going to let you guys know how you can hear from us about construction updates, how you can contact us, and we can stay in contact about what's going on. And then we'll talk a little bit, just for a few brief moments, about what's going to come in, in the future with that facility. And then we're going to end in Q&A. So since we're at the Q&A part of the agenda briefing, I want to talk you guys about how you can engage with us this evening, because I'm sure that some of you are here to ask questions. And so the way you can do that is through the Q&A box. You'll see that at the bottom of your screen. If this is the first time you've ever joined a virtual meeting with the Zoom webinar platform, you'll notice it's maybe a little bit different than what you would see in a normal Zoom meeting. You'll see that Q&A box instead of a chat box. So that's where you want to put your questions and your comments. The reason we don't use a chat is because it's not secure, both for the panelists and both for you guys. These meetings are public. Anybody can register and attend if they wanted to. And there have been instances, not with Larimer County, but with other entities, of folks getting on, those Zoom webinar or those Zoom meetings, sending out links that infect folks' computers with viruses or send them to websites that they don't necessarily want to. It also protects the video as well, so we can't see you. We don't know what you're doing in the way that you can't also, project onto everyone else's screen either. So that's why we use the Q&A box. If you have things that aren't questions, you just have comments, that's totally okay. Put them in the Q&A box. The only thing I filter out is for suspicious links or maybe bad language. I never had the bad language thing happen because everybody here is very respectful of each other. But I will, if you have comments, I'll just keep posting them up. I just want to make sure you're not going to infect anybody's computer with a link. Another way, if you don't want to use the Q&A box, at the very end, we're going to do the Q&A section where we'll go through those questions that were submitted. You'll be able to raise your hand. You should see a raise your hand button at the bottom of your screen as well, for if you want to talk to us. And I'll walk you through those steps when we get to that point. So we'll go over that again a little bit later. Let's do some introductions so you guys know who you are looking at. As I said earlier, my name is Michelle Bird. I'm the Public Affairs Director. My purpose tonight is to be slight facilitator, slight Zoom host, IT, kind of best of both worlds. So I'll be kind of guiding us through the conversation tonight. And then I will turn it over to Ken and we will just go down the list. Ken, go ahead.
Good evening, everybody. I'm Ken Cooper, Facilities Director for the county. We appreciate your time this evening and look forward to sharing some good information for you.
All right, and we don't have Lori with us quite.
We do.
She's here. Oh, she is here.
Yep.
Awesome. Go ahead,
Yep.
Lori.
Good evening. I'm Lori Cadridge, and I'm the Director for Community Planning and Infrastructure Resources. And the landfill is one of the departments in our service area.
Thanks, Lori. You snuck on without me seeing you.
Sorry.
That's okay. Thanks for being here. Lori, still go ahead.
Good evening, everyone. I'm Laurie, number 2, Laurie Stoll, and I'm the Behavioral Health Services Director. So the ultimate end user of the behavioral health facility that we're talking about this evening. And I appreciate everyone being here with us this evening. So thank you for spending some time with us tonight.
Jennifer, go ahead.
Yeah, hi, good evening, everyone. My name is Jennifer Wolf Kimball, and I handle the communications for behavioral health services.
My name is Ashley Pace. I'm the communications specialist for Larimer County Solid Waste.
My name is Jill Burrell. I'm the owner's rep for the county on this project. I have helped through the facilitate the portion of the design project, and then will be involved during the construction process, working directly with Hazelden on behalf of the county.
Good evening, everybody. I'm Kevin Hoff. I'm with Hazelden Construction. I've been with them for 16 years, and we got a great team on this one, so I'm really looking forward to getting this one kicked off.
Well, thank you guys for introducing yourselves, and we're going to jump into the presentation portion of the evening. So I just want to remind everybody, if you have questions that come up as they're giving their presentation, use that Q&A box, put your question in there. We'll get to them at the end, but you don't need to wait till the end to put your question in there. And then for my presenters, we're kind of jump around. Different people are going to present different slides, but we're going to turn our videos off if we're not presenting so that we're not a distraction to you, our audience, and you can kind of focus on the presentation. So with that, I believe our first slide, we'll go to the first slide. It'll remind me who's in charge of the first slide. Oh, that's right. Lori, go ahead.
Thank you, Michelle. So I thought that it would be helpful just for a little level setting for everyone that's with us. And although I'm confident that you are here because you are familiar with the initiative itself, I just wanted to give just a few minutes of background to catch us all up. So we did utilize a Larimer County Community Master Plan in 2018 to help inform the needs in our community that ultimately resulted in a ballot initiative that successfully passed. And you know, it's been a long time coming. There was some efforts about increasing revenues and resources for mental health in our community since about 1999. Ultimately, a group of folks that then called themselves the Substance Use and Mental Health Partnership formed in late 1999 and continued to ask tough questions and try to come up with Band-Aids, short-term fixes. What can we do with what we have? And it ultimately always ended up that the biggest issue in our community was a lack of dedicated resources to really expand and enhance behavioral health in our community. So since this initiative passed as a 20-year dedicated funding stream, we really have new opportunities in our community to do things and expand services and access to affordable and appropriate behavioral health like we never have before in our community. So our department was established after the ballot initiative passed, and we are now a staff of 6 people, myself and 5 staff that are doing just tremendous work in providing over $6 million in grants to date to over 110 different, and actually they're not different, over 110 grants to providers in our community. Some of them are duplicate from year over year for the great work they're doing. And then oftentimes we have new providers that come forward and are asking for grant dollars. And so we are excited to partner with our behavioral health providers in the community to really do this multi-pronged approach to expanding behavioral health. The goal of this behavioral health facility is to be a hub of crisis services. And so really it is intended to address folks that are in crisis and then ultimately develop a plan for them to be reintegrated into the community-based levels of care. And our ultimate goal is to have really strong partnerships with those that are providing outpatient, a variety of different levels of care that don't need residential beds to provide their levels of care. So ultimately, it'll be 64 beds in this facility, 6 different levels of service that will be provided by Summit Stone Health Partners and UC Health. The goal is to be able to start the construction yet this year, as we have been planning for this since 2019, and it's been long coming. We ultimately are going to be providing different levels of care that include detox, a couple different levels of detox, crisis stabilization, short-term intensive residential treatment, and then a very robust care coordination program in this facility as part of the phase 1 of this project, which is the first 5 years of this project. So we are really excited to develop the strong partnerships that we have in the community and be transparent and open about our communication all along the way. Hopefully, I know that was a very quick overview, but that gives you a little bit of a background of how we got to here and ultimately what we're planning to provide in this facility. I'm obviously happy to answer questions at any time they come up for folks. So with that quick project background, I'd love to hand it over to our facilities director, Ken Cooper, for him to take it over from here.
Thank you, Lori. Yeah, we're excited to get rolling on it. Kevin Hoff, our construction manager with Hazelden, mentioned that it's been a while that we've been working together, and certainly excited to get into the project itself. These next several slides are going to show images of the building, renderings that have been done. That left image is the main entrance. There's some other support spaces that you see there, the lobby on the far right of that image. And then the next slide will show us a closer version of the main entrance, which beautiful building, roughly 60,000 square feet. That again is the lobby that you're seeing right now. These are all renderings that'll be very, very close to what you'll see built in the near future. Courtyard space, support space that you see, some office space. There were heavy emphasis on lots of daylighting, an awful lot of space for easy flow for clients and certainly for staff, for visitors. The overall welcoming piece to it is very important. The serene qualities of the spaces within, for treatment and so on, is very important to us. And Paige Sutherland Page was our architect, had plenty of experience on similar buildings like this, and the whole team really came together. Ditesco helped lead that. Lori Stolen's teams were heavily involved, of course, on all the design pieces of it. About a 60,000 square foot facility, and we're very, very excited to get rolling on it. So in terms of the contacts as we go forward, there'll be this is a quick look at the timeline. Again, going back to 2019, when we first formed, we went through competitive processes first on the need to get an owner's rep hired in, and then following that, the actual design team, again, that was Paige, and then Hazelden was brought in as a construction manager at risk, which is basically a negotiated element where the construction team is brought in to help kind of guide and look at opportunities to save, look at opportunities to try to to sequence things in a way that is a better fit for the project and for those that are moving through that construction process. Very happy again to be at this point now with with what's been a very involved project to date. We're very excited to get rolling here in December, and I know you folks that have been waiting for some time are excited as well. So the project will wrap up, we're expecting at this point, and opened up in 2023. So we've got some time yet. Again, very pretty exhaustive site work that has to happen. And then of course the actual vertical construction that'll happen, to create the space. I think the next slide shows the folks that you can contact. Again, my name is Ken Cooper. That's my cell phone on there. I'm happy to take calls anytime. And then Jill, who introduced herself earlier, is the owner's rep for Larimer County, and she works with Ditesco. And her phone number is on there. And then Kevin, who introduced himself earlier as well, is the project manager with Hazelden. So we're all happy to be here, very excited about this project. Certainly have had great involvement already from the community and great support. And with that has come some extended time periods. So I know that many of you have heard incremental updates and so on. But again, we're very near the starting point, which is in some ways a finish line, but very excited to see the construction itself take off. So with that, I think Michelle has got some information that she also wants to share now.
I just wanted Ken really quickly to check in with Kevin and see if he had anything he quickly wanted to add about the project timeline or anything else with your involvement, Kevin.
Yeah. So we are getting kicked off. We have our stormwater permit approved, all our erosion controls. So we're going to be mobilizing pretty quick here to set up all of our control measures for the stormwater, and get the site all prepared so we can start construction here. I saw a couple questions. Lori answered the one about which direction the entrance faces, the southeast. And then there was one about a drone of the site. So yeah, we will have some drone photos, I'm sure. I sometime have my drone license, so my part 104, so fly over the project, I'm sure, a couple times. As far as the construction schedule, we're planning on getting going. We're going to dry in the building around September of 22, and then finish up there in 23. So that's about as much in the schedule I wanted to get, unless there's any specific questions.
Great, thanks, Kevin. And I'll have Jen move us a couple slides forward. So staying connected to us staying connected to you guys is very important for us. So there's definitely a few different ways that you can stay connected with the project as we move forward. On larimer.org, you can either go to larimer.org/facilities, which will direct you to our project page for this behavioral health facility site, or you can go through the behavioral health page. Both of them will get you to the same place to learn more about the project. As Kevin said, we'll probably have some good drone footage. We don't have any quite yet, but when we do, that'll probably be where you can find that footage as well. We will continue to update on Nextdoor for the neighborhoods that are close to the construction site. You may have received your invitation via Nextdoor or through a postcard, but for big updates, we will continue to do Nextdoor. We find that a lot of folks do use that, and it's a good way to communicate. To receive inbox or updates via email, there is a way for you to do that on the behavioral health page, larimer.org/behavioral health. You can sign up to receive email updates as well. Or you can email your questions into behavioral health construct at larimer.org. So staying connected to you is very important to us. Please do not hesitate to contact us either through the contact information given on the previous slide if you want to talk to a real live person, or if you just are more interested in staying updated as things go, either through the website, Nextdoor posts, or email is probably the best way, unless you have like a question you want to get answered. So it's very important for us that you guys, when you have questions, reach out to us. We want to start off communicating well about this project into the future. So with that, a fun part of the evening before we dive into the Q&A, and I see more questions are coming up. And we will, I see more questions popping up. We'll get to those at the end. But let's talk a little bit, just a sneak peek into the future. Lori Stolen, I think you are up.
Yes, thank you, Michelle.
Again, so I could probably hand this over to our communications person, Jennifer. So please, Jennifer, if there's anything that I missed that you want to add in, please feel free. We are working on a temporary facility website that we are going to get up and running quickly. So it will be under construction, but yet it will have some links, resources, and information. And hopefully it will direct people to the information that they need. And then we will be developing out a full facility website with our partners from Summit Stone and UC Health throughout the construction phase, with the goal of having that main facility web page up and running by the time the facility opens. We are looking at, in the next couple of weeks, being able to announce and talk with our Board of County Commissioners about name and logo options for the facility. And so we are very excited to be moving forward with identifying a name. We've been calling this facility the BHS facility for a long time. And we anticipate that the name and logo are going to kind of be a milestone, you know, a landmark in this effort. So folks can start to get familiar with what it will be called and its address, and, you know, referring to it by name. And then ultimately throughout the year of 2022, our goal is to be really good communicators in scheduling meetings and accepting meeting invitations, and doing what we've been kind of coined as our road show, to get information out to the community about the services that will be provided, who our partners on the project are, how do you get referred, how do you use this facility, who can use it, you know, all the questions that people I'm sure will have, that maybe they wouldn't find out at a website, or they would just rather ask the questions in person. So we'll be doing some virtual as well as in-person presentations and listening sessions and meetings with folks. Anytime that there's someone that would like to talk to us about the facility and the services that are provided, our intention is to be available so we can get the right, good, timely, accurate, and thorough information out into the community.
All right, are we ready for questions? So before we dive into the questions, I'm gonna ask my panelists to come back to me. Let's get cameras back on so folks can see our faces as we answer questions. And I will remind folks, again, you can use the Q&A section. People are asking questions away. We're typing out some answers. We might review some of those that we've already typed out answers for. But for folks that maybe haven't been paying attention to the Q&A box, there are some questions, some answers happening already. And then you can raise your hand if you want to chat with us. I'll walk you through the unmuting yourself process once it's your turn to chat, but please feel free to raise your hand. We're going to get through as many questions as we can this evening, and hopefully we will get to them all. And if not, what we do is we have a way to save all the questions in the Q&A, and if there's any of them we can't get to tonight, we will reach out individually to you. Since you registered, we have your email address, and we will reach out individually to you if you ask a question that wasn't anonymous. Unfortunately, if it was an anonymous question, we don't have a way to reach out to you that way, but we will do our best to get through all of the questions asked tonight. I'm going to start off with a couple questions I got emailed to me, and then we're going to jump into the Q&A. So the very first question, and actually there's two questions in a row. I see Craig is here tonight, and Craig was the one who asked the questions. So Craig, if you have further questions as we're responding, feel free to raise your hand and I can unmute you and we can chat together. But the first question is, and I think maybe Ken might be the appropriate person to respond to this. There is talk of building a trail to connect Kathy Fromm to Coyote Ridge in conjunction with building the facility. Is this going to happen with building the facility? And what can we make happen, or what can we do to make this trail connection happen?
Good evening. Yeah, there's no plans currently to have that be a piece of this project. The future phase or phases of the project could include a connectivity to the trail, which would extend south toward Coyote Ridge. I'm not sure if Lori Cadrich might have additional information, maybe from the development side of things, but as it relates to the construction for behavioral health, we are not going to be able to have that be included in this project. So
that won't be included in this phase of the project for sure. That doesn't mean it might not be included in the future. We just don't know yet. And I think that kind of leads us to our next question, which I think Craig might be disappointed in the answer. But the question is, what needs to be done to create a paved path from the Longview Trail to the potential new trail from the question above? It would be nice to have a path so I don't have to walk/run on Trilby. Craig, that's a very good question. And unfortunately, we don't have Natural Resources Department with us here tonight. So what I'm going to do, I am going, Craig, to forward your question on to the communications specialist from Natural Resources and have her contact you so you can talk about that with her. They're the ones who oversee the trail, the trail projects here at Larimer County. Our facilities and our behavioral health folks really don't have a lot of say into that. So I see your question, Craig. We will reach out to Natural Resources to get that answered for you. So with that, let's jump over to the question and answer section. I am actually seeing quite a bit of questions about stoplights, what's going to be done about stoplights. And I see you guys have answered them, but let's talk about it for the whole group. I don't know if Kevin or Jill are the right people to talk about what's going to happen with the intersections. Let's talk about both at Trilby and Taft Hill right at the corner. And then there's questions about Trilby and Shields. I'm not sure who wants to take on those two.
I can get started, and then Kevin can back up and answer questions probably more on schedule and then any of these other items. So as part of the planning process for the project, we did a comprehensive traffic study of what the additional traffic loading would be because of this facility. And that showed that we did require a traffic light at Trilby and Taft. And so that is part of the construction phase. We will be installing a right-hand turn lane from northbound Shields onto westbound onto Trilby Road. Did I say Shields? I meant Taft. If I did, I apologize. So we're just improving that intersection with the signal, which will be a huge improvement. Sometimes there's waiting times. I've been out there waiting multiple minutes just trying to cross the street. So we are planning to do that. We are not planning on doing improvements at Shields and Trilby right now, but that's, I posted the contact information for the Fort Collins Traffic Operations Group. And that would be the best resource to reach out for additional turn lanes in that location. I know that the Fort Collins Traffic Department, who's in charge of the entire signalization in that area, frequently does updates to their traffic master plan and directs improvements based on traffic flows. So they would be a great resource for you. As far as actual construction of the improvements in the intersection, Kevin can talk about that a little bit more.
Yeah, so we're planning on getting going that come springtime after we get out of the winter months. We have Connell Resources. They're going to be doing a lot of the paving. Yeah, and then the city of Fort Collins is actually providing the traffic signals there. The only other thing, we have a couple water tie-ins that we're doing across Taft Hill as well. So yeah, those are the improvements at that corner.
Thank you, Kevin. Thank you, Jill. And I'll just reiterate, for those of you that have concerns about the stoplight at Trilby and Shields, which Shields and Loveland is Taft, so that's confusing for folks. But the one in the middle, Jill did put information about how to contact City of Fort Collins Traffic Operations, and please do contact them about those concerns. The more they hear from you, the better it is to get a response. So please do that. The only other question we had already answered that in the Q&A section was what direction does the entrance face? And Lori did say that the main entrance of the facility does face southeast. Lori, I don't know if you want to elaborate a little bit about how the facility is set up and where it'll look from different angles.
One of my favorite parts of this project really was about the conversations that went on to situate the facility on the site to the most advantageous angle. And the goal really was for the view shed towards the west to see the foothills and to take advantage of the sun and to reduce the pileup of long-term snow and ice. Hopefully it's situated in a way that our entrance gets a lot of sun and it melts quickly, and that it's protected from the wind the way that it's situated. And so ultimately, when you drive right or west on Trilby, you'll take another right or head north into the main parking lot, and there'll be a drive-through for public access into the main entrance. And then on the south side of the building, there will be a sally port is what we call it. It's a drive-through, a kind of a closed-in brick and fence area for our first responders, law enforcement, ambulances that have their own sort of an emergency or first responder entrance into the facility. We didn't want folks that were in crisis at that level to also be interacting with the public that may be walking in the front doors. And so we have two separate entrances for our first responder partners and for the public. And then obviously around the back of the building where the employee parking is, there'll be an employee entrance as well. But the main drive in the circle area and the landscaping has really been focused on the main entrance for the public, which is at the southeast corner of the facility.
Thank you. Very exciting. All right. And Lori, I think you probably still, Lori Stolen, I think you're probably the right person to answer this next question too. Will there be better public transportation to this corner?
The $64 million question. So wish that I could say that our regional transportation challenges were going to be addressed with this facility, but I can't say that. What I can tell you is that it's a long-term continuing conversation with our municipal partners to stay around the table and talk about what are our most viable and economic and efficient ways of providing transportation between our two most populous city centers of Loveland and Fort Collins, so we can connect the roadways between the two municipalities. As far as transportation for the facility itself, we are working very hard at figuring out multiple ways for folks to get transportation to and from. I mean, ultimately, we really know very well how people get to crisis services. They oftentimes get there by family, friends, and ambulance or law enforcement. What we really want to focus on is how do folks leave the facility? We want to be intentional about that. We want to provide public transportation such as taxis, Uber opportunities. We want to connect them with their pro-social supports of neighbors and friends and family when that's appropriate. And then ultimately having dedicated transportation from the facility to wherever that most appropriate next location is, making sure that they get those warm handoffs to the referral agencies, whether it's going to an outpatient program or if it's going to a higher level of inpatient programming, depending on the individual's needs. And so transportation to and from this facility in all directions around Larimer County is at the forefront of our minds. We're looking at who our municipal partners are for Estes Park, for Wellington, for Berthoud. We're really wanting to make sure that we're not leaving people without transportation options. And the very last thing that we want is anyone to walk away from the facility. And so ultimately our goal is to be able to have an abundance of options for people that would appeal to what their needs are at the time to ensure that they have the right level of transportation based off of their individual treatment programs and needs.
Thank you, Lori. And I know that question wasn't truly around the construction, which is kind of what we're trying to focus on tonight, but it is the $64 million question. And we definitely wanted to talk about it this evening so you guys know what's currently being worked on. I just kind of want to reiterate that tonight we're kind of focused on construction, how it's going to impact the neighborhoods. And so just remember that there is going to be a slew of public outreach around the facility services that are going to be provided here in the spring to next summer, next year, more, you guys can learn more about the facilities that'll be provided, the services, or not, I'm sorry, the services that'll be provided to our community. So with that, I have another question. Might be a Ken question. I'll just throw it to the group and see who wants to answer it. Will West Trilby Road be paved with this project? There is a 1 mile stretch west of Taft Hill to Hidden Springs Road.
Thanks, Lori, or Michelle. Thank you. Great question. The current plan for that road is to extend it as far as it needs to be to get to the location for the behavioral health site. However, the county is still considering and still actively looking at different options for a transfer station, and so that if and when that project happens and at what level it happens, would further extend the road further to the west. So I don't know if Jill perhaps, or even Lori Cadrich might want to add to that in terms of the transfer station. Again, that project was planned for some time to be a sister or kind of a partner project with this with behavioral health. Hazelden Construction was selected to do the construction for both projects. Different design teams. The timing of the two projects was working well. There were a number of things that happened in the market related to solid waste that directed the county back to being in a position where they wanted to kind of revisit some things and reestablish what really needed to be happening and get built for the transfer station. And so there is some uncertainty yet for what that will look like. I don't know, Lori Cadrich, if you'd like to add to that. Thank you.
Thanks, Ken. I think the main thing to add is that if the transfer station is built, we're certain that we'll pave to the entrance of what the transfer station is. But I am not certain that we would pave the entire 1 mile section. And the initial feedback we heard from residents is they would prefer that we didn't pave that whole section because they want to discourage people from using their private road and having quicker access to Taft Hill Road. And so there'll be more conversations to occur if we do move forward with the transfer station.
Great. Thank you, Lori. Thank you, Ken. And I know Jill had mentioned that she has an exact number of how many feet will be paved, and it is 1,100 feet of Trilby will be paved east of Taft Hill. So I hope that's very specific. And
Yep.
if anyone wants to take the tape measure out, it's 1,100 feet, to be very specific.
Plus or minus. Plus or minus.
Plus or minus, that's right. And I think I have a question, or not a question, but a comment here, Stephanie, that I think is a very valid comment, not necessarily a question that's attached to it, but please keep in mind that there are 20 lots that are located behind the landfill that access Trilby driving east on Taft Hill. And I think that's very valid, Stephanie. And it kind
So
of,
to kind of tack onto that one,
yeah, please.
there was another similar question about what kind of impacts the project will have to close neighbors. So our goal is to keep any impacts obviously as minimal as possible. I mean, we'll have site fencing with screening on there. We'll be dewatering, so or I'm sorry, we shouldn't be doing any dewatering, but if there's any dust, we'll be moisturizing the soil so it doesn't create dust. We have street sweepers, and then we also have lots of traffic control. So any additional traffic will be directed onto the site. And we have all our staging on site. So we should be able to keep Trilby open for everybody to pass through there. Now we will have to close down for a portion of time when we do that paving, but yeah, it should be minimal impact to everybody. And this is kind of why we're reaching out to. If there is any impact, feel free to contact us and we'll make sure that we're getting concerns addressed.
And I think that's actually a really good segue here, Kevin, to we will be using that email list that if you sign up for email, we will update folks, especially when things like if there's going to be any type of road closure, we'll make an update there. We'll make an update through Nextdoor as well. And we'll probably do some social media outreach, those types of notifications when there is some type of big impact like Kevin was mentioning, which brings me to a really good question that we have, which was why weren't all neighbors around the landfill notified and invited to this meeting? Please send future meetings to all neighborhoods. And it was someone anonymous who asked that question, which if they don't want to respond to my question back, how should I say this? We had a pretty big circle that we invited to this meeting. And if somehow we missed a neighborhood that you think needs to be notified, we can talk about what our circle looked like. But please, if there's a neighborhood that you think we didn't hit for this meeting, postcards were sent, direct mail was sent out to Jennifer Wolf Kimball. Can you remind me how many folks we sent direct mailings to?
Sure, just under 1,400 direct mail postcards.
Just under 14 direct mail postcards were sent out to neighbors surrounding the landfill, definitely even to the west, to the south, anyone.
1400.
Yeah, 1400, so 1,400. And then along Trilby, we invited pretty much folks that had any type of main artery coming out of Trilby. So if you would prefer to just send an email to that, what was the email again, Jennifer Wolf Kimball? And maybe I can throw it in the chat.
Sure. It's bhconstruct@larimer.org.
Okay, bhconstruct@larimer.org. I'm putting that in the chat for everybody if they want to copy and paste that. If you aren't comfortable saying what neighborhood it was, please do let us know, because we want to make sure we're including everybody in our communication here tonight. So I'll turn it over, Jennifer, if you want to elaborate on that question at all.
Just on who received the postcard?
Or just what I don't know if you can remember the neighborhoods off, if you can elaborate any more, or what other type of.
I can't off the top of my head. You're right. So we did include the residential addresses we had to the west of Taft. And then, as Michelle said, we focused along that corridor, a 2-mile stretch from that Taft Hill and Trilby intersection up to College. So all the subdivisions and residential addresses we had along that corridor were included in the mailing that ended up being about 1,400 addresses in total. So like Michelle said, if there is an area that we somehow missed in that list pool, we sat down with maps and tried to identify all the areas that might be affected or impacted at all by this project, or interested in hearing about this project. So if there's an area we didn't miss that we need to include in the future outreach efforts, please let us know, because I want to make sure that I include that moving forward.
Thank you so much, Jennifer. And I know that there was some questions more along the services, the types of services that were going to be used, that Lori was gracious enough to jump in there and type out the answer for. And again, I don't want to drone on about future outreach, but there will be future outreach about services in the future. Lori, I can't say your last name, Lori, I don't want to butcher it, said 1 address in Wildflower was notified out of 4 addresses. Lori, we'll have to look deep into that more. I know we included, at least in what we pulled, the Wildflower addresses. So if somehow they're getting pulled out of GIS and we didn't get those, we would love to hear what addresses did not get contacted, so that we can, add them to a list for future updates. Absolutely, but it was not an intentional. We mapped things out with GIS, and if some addresses were not included on Wildflower, it was absolutely not intentional. So we'd love to hear what specific addresses they were, so we can see where we went wrong with that. But our apologies, absolutely, if we missed some of those addresses.
Yep, and if you feel comfortable, sending the specific addresses, because I do have a couple of addresses that returned to sender that were considered undeliverable. I can check those against the master list that we got from GIS for this, and just make sure there's not information missing that would prevent you from getting direct mail in the future from us, because that's just the system that we have, the address we have on file for you. So if there's something odd or wonky about that, I'm happy to look into that too. Wildflower was a priority community for us to connect with. So I'm a little concerned that many people feel like they didn't receive the postcard. So I would love to look into that. So if you're comfortable giving me a little bit more specific information, you can send that to me directly if you want, and I'll go through the list and make sure that we have that covered.
Thank you so much, Jennifer. And I'm seeing some more questions about kind of the services and what impacts will be once services start. And truly, I want to stay focused on construction this evening, because that's truly why we're here. And that's why everybody that's here gathered tonight was to talk about construction. So for those of you asking questions about what services are going to be like once the facility opens, please be on the lookout for more public meetings in the future where we can answer those questions. And we'll have a better idea of what those services are going to look like just the closer we get to the opening of the facility. So with that, I am waiting a little bit to see if we have any other questions pop up. But I want to go back to my panelists and ask if there is anything they maybe didn't get to address tonight that they thought of as we were doing our Q&A section here. Awkward silence. All right, so that means our panelists kind of got, or they were able to talk about what they wanted to talk about tonight with construction. Jennifer, can you go back to the contact slide? I want to give folks the opportunity to take a screenshot, or yeah, we'll go through these two. We'll give just a few seconds here for folks to jot down some phone numbers, and then after a few seconds here, we'll go to the next slide so you guys can websites and email addresses again. We do have a question about what happened to the transfer station project. Ken did briefly talk about that, but opportunity. I don't know if Ashley or Lori Kadrich want to give an update on that project.
So we are still planning to build a central transfer station. Like many construction projects over the course of the last couple of years, there have been delays, there have been things that have kept those projects from moving forward. Ken alluded to one big potential impact for that project was that we had Republic Services come in and purchase Gallego Sanitation. And with that national company coming into the Front Range region, we needed to make sure that any potential infrastructure that we were going to be building would work for them as well as our other major haulers in the area. So before we moved forward with anything, we needed to be sure if they were going to partner with us. If they weren't, we would have to dramatically change our construction plans to accommodate a lower amount of material that would be collected. Another thing is we had changes both in county leadership and leadership within the solid waste department. And then we've also been impacted by the pandemic, just like many people. It's changed kind of our estimated budgets for projects, timelines, a lot of construction delays due to, material shortages or supply chain issues or labor shortages. So that project still is going to happen. We hope to have updated plans released early 2021. So check back at larimer.org/solid waste, and we'll be posting updates about that project there.
Do you mean 2022, Ashley?
What did I say? Yes.
You said 2021, but that's, we all, you meant 2022 and you weren't going back in time. So
I'm still stuck in 2020, isn't everyone?
I'm still stuck in 2019, so you are good. All right, don't we all wish we were still stuck in 2019? Thank you, Ashley, for that update. I don't know if Lori wants to add anything to it or not. I'm not, oh, there she goes.
Thank you, Michelle. I had turned my video off so people could see the slide better, so I was caught off guard there. The only other thing I would add is that for folks who are aware or were aware of where the transfer station was originally going to be located on the site, we're certain at this point that it won't be at that location. So we need to move that facility a little bit further south and west likely. And the reason for that has to do with the type of material that was at the original location, and that material is desperately needed for the closure of the current landfill. And so there would be some modifications to the location on the site. And we will definitely keep the neighbors engaged and involved as the project moves along.
Thank you, Lori. And then I'm going to ask Jennifer Wolfkimball to go to the next slide really quickly in case folks need to write down some website addresses or again, email that question. I did put the email in the chat box for people to copy and paste if that is easiest. But I am not seeing any other open questions. I don't see any hands raised. So I think this is probably a good time for us all to say good evening. And along our merry way, get to some Monday Night Football or whatever you have on your schedule for the night. So panelists, thank you, of course, for being here and helping notify our community. Oh, looks like really quickly we have a question about contact. Jennifer, you want to throw your email address or into the chat box for us? All right. So with that, let's go. I'm trying to wait so Jennifer can get her email in there and Lori can snag it. But I guess we can everyone else can say good night. Thank you, attendees, for being here. We appreciate being with us this evening. All right. Good night, everybody. Take care.
I accidentally said I would answer it live, and instead I would like to type it, and now I can't end the meeting.
So what we can probably do is Lori's still here. So Lori's hanging out with us. Hold tight, Lori.
Okay. Lori, I'll get it to you in a minute. I clicked too fast.
I think you can still.
If I hit done, well, no, if I hit
answer.
done, it'll go to answered. I can't type in there.
Once you hit done, and you'll be able to go in, I think. Go into answered.
I find it again.
And you should be able to type an answer.
There it is.
Thanks, folks, for hanging out with us. It's always those last minute things that pop up right as I'm those awkward goodbyes in Zoom, right?
There you go. Okay.
All right.
All right. There it is, Lori.
Lori was able to copy and paste and give her just a few seconds. But Jen, if you want to sign off, I'll wait until I see Lori sign off just so I know she's got it.
Okay. Sorry about that.
No,
Thank
that's
you.
okay. Take care.
Thanks. Bye.
All right, Lori, I'm hoping you've had enough time to get Jennifer's email. I'm actually going to throw it in the chat box just in case. You can copy and paste it there. It looks like Lori jumped off. So good night, everybody who remains. Have a good evening.